I'm giving a presentation on postpartum depression. We've been working all semester in my Capstone class on this. We've done discussion boards over it the whole semester to make our final project. So that's my first slide. The problem. According to the American Psychological Association, 1 in 7 women experience postpartum depression, and about half the women who are diagnosed with postpartum depression are experiencing signs and symptoms of it during pregnancy. According to Daniel's 2013, an early diagnosis of postpartum or of depression during pregnancy can help avert the noxiousness that may occur to the mother and child, including premature birth weight, little to no appetite, poor weight gain during pregnancy, stunted birth weight for infants, and even suicide. Maternal mental health problems during the postpartum period pose a threat to the mother and infant bond. Lack of warm, caring maternal feelings due to postpartum depression has been shown to have a negative impact. I've come up with a solution for the problem at hand, which would be screening pregnant women for depression during their first, second, and third trimesters. According to a systematic literature review, prenatal depression affects around 12% of women, with the highest of that being in the second and third trimesters. Screening these women who are pregnant would result in more immediate treatment and decrease the rates of postpartum depression. Because I think women who are pregnant, I don't know that there's an actual protocol to screen pregnant women as you do with postpartum. So I did my literature review. I did an article by Deborah Reck, Muller, and Golick, and they used a screening tool called the Edinburgh Postpartum. Oh, I'm going to change my slide for you guys. The Edinburgh Postnatal Depression Scale, and that scale measures maternal depression, and they also did the State Trait Anxiety Inventory, which measures maternal anxiety. They used 433 pregnant women in this. Results showed that the only correlation that maternal education was the only direct correlation to bonding. And it also found that both anxiety and depression during pregnancy can have an effect on the mom and infant. Mothers are more attached to when they're more attached to their unborn children, they're more attached to their born children. Statistical findings show that pregnancy-related anxiety, depression, positively correlated with postpartum bonding. Another study that I looked at, done by Teets, Zietlow, and Reck, studied the effects of maternal mental health that can affect the infant before and after birth. Much like the study that we just talked about, it proved that anxiety and depression led to difficulty developing a bond between the mom and child. Statistical findings were mothers with postpartum anxiety disorder had significantly lower bonding with healthy mothers. So kind of what is across the board is that when you have the pregnancy, you're depressed and you're pregnant, or you have anxiety, a lot of times they find that when you have a baby, you have a harder time bonding with that baby. Need for treatment and interventions. Another study that was done focused on researching how many women sought treatment for mental distress during pregnancy. It was shown that 6.4% of mothers experience mental distress in the first trimester. It decreases to 4.3% in the second and 3.9% in the third trimester. The first 2 months postpartum, 4.6% experience mental health issues. It then increases to 6.9% in the next 3 months. Of these numbers, researchers found that 38.5% of pregnant women and 49.5% of pregnant women postpartum women received no treatment for depression or anxiety. Almost done with my literature review. This is one study done to prove that telephone interviews could survey a population of pregnant women just as well as a face-to-face interview. Researchers studied the effects of screening pregnant and postpartum women for depression using the Edinburgh Postpartum Scale Edinburgh Depression Scale again by evaluating the effectiveness of the scale via a telephone approach. Mental health professionals did the first intervention, and if you scored a 10 or more, then you were invited back in for a face-to-face interview, and then the pregnant female gave the interview to herself. And during this process, a total of 199 people participated. 90 of those women were diagnosed as clinically depressed, and it was shown that you could use that EDPS as an alternative for depressed screening, and that the telephone interview was just as effective as the face-to-face. This is a study that was done to help inform physicians about interventions to screen and treat depression in pregnant females. Physicians, nurse practitioners, nurse midwives, social workers, they were all given a survey in the mail and completed it. Data was examined from these surveys, and we surveyed confidence in diagnosing and treating depression. Emphasis was placed on screening and treatment of depression. The results were primarily concerned with the level of importance placed on treatment of perinatal depression, as well as the healthcare providers' confidence in providing information on screening and treatment. Results of the study found that providers who completed this study, 71% would regularly assess pregnant women and postpartum patients. Of that 71%, only 51.6% were comfortable with treating or referring, 33.5% did so, 12% never did. The study found that motivational interviewing could be a useful interventional strategy in future statewide prevention. Now I get to my burning PICO question. We worked on that for 2 semesters. So I made this PICO question. It's kind of what the whole paper has been about. And my PICO question is, what is the effect of screening for depression in adult females throughout the prenatal period as compared to no standard depression screening method on postpartum depression? And the PICO has 4 parts, P, I, C, and O. The P is the patient population, and in this case it is pregnant females. I is my intervention, and that's screening for depression in the pregnant females in your first, second, and third trimesters. The C is comparison of screening the females who are screened compared to females who are not screened. And my O is my outcome. My outcome is hopefully increasing the number of females being screened, which will increase screening providing increased depression diagnosis. Theoretical framework. Mercer's role attainment theory was developed as a framework for nurses to provide appropriate health care for interventions for mothers in order for them to develop a strong maternal identity. This process helps facilitate bonding between mother and infant. This has 4 processes called anticipatory, formal, informal, and personal. The anticipatory stage is birth. Is the adaptation and expectations of maternal role. The formal stage is assuming the maternal role at birth. The informal stage is when the mother develops her own methods of mothering, and the personal stage is the joy of motherhood. This theory is applicable to the research proposal regarding screening for depression in adult females during pregnancy because statistics show that women who suffer from depression have a decreased maternal bond with their infant. When pregnant women are screened for depression, it's more likely they will receive treatment. Using Mercer's model, nurses are able to screen mothers for depression and provide appropriate health care interventions. The design of my study would be quantitative experimental, done in a moderately sized physician's office where the physician sees approximately 1,500 patients per year. We would have a control and an experimental group, a total number of 60 participants, and the participants would be given the opportunity to participate when they make their scheduled appointments. 30 would be in the control group, 30 would be in the experimental, and they would be randomly divided and assigned numbers using a computerized program called Research Randomizer. They must be at least 18 years of age and pregnant, and it would last a year so that the initial screening halfway through and at 3 months postpartum would all be done. Screening for depression is not routinely done in the prenatal period, but both the control and experimental groups would be screened for postpartum depression. Those in the experimental group who are clinically depressed would be treated with an oral medication safe for both the mother and fetus. The control and experimental groups would be screened again at 3 months postpartum. The results from the control and experimental group would be compared. Their rights and confidentiality would remain protected throughout the research study. We would give them we would let them know everything that the study involved. They would sign informed voluntary consent. 2 nurses would witness, and our forms would explain the purpose of the research. Data would be collected on the participants for a year, and during that time, they would be given the Edinburgh Postnatal Depression Scale, which measures the maternal depressions by patients answering a series of questions on a questionnaire. They would be given the questionnaire twice, once at the beginning of the study, once at 3 months postpartum. The EDPS has shown reliability when used in past research. The validity of the test in past research studies has shown greater than 0.8%. An unpaired t-test would be used to analyze the data. The unpaired t-test assesses whether the means of 2 groups are statistically different from each other after comparing data pre-test and post-test. The unpaired t-test would show if there's a statistical difference throughout pregnancy versus not screening women who are pregnant. Conclusion. Depression in pregnant females can have a negative impact on both the mother and the fetus. The evidence supporting screening pregnant women during pregnancy for depression is well defined. With further research, the number of pregnant females who are depressed will decline, improving the bond between mother and fetus. For screening to be successful, healthcare providers must make it part of their practice to routinely screen women who are pregnant for depression. Then I got my references. And that's all.